Mrs. A was not one to complain. She was a hard-working farmer who had recently lost her husband of 59 years and continued to live alone on the farm, though most of her chores were now done by a hired hand. Pain and stiffness were not new to her, but recently there had been some new life-limiting neck, shoulder, and pelvic stiffness, along with a loss of appetite and weight loss. As she was close to 80, she blamed it on her age, an old mattress, and work in the garden. But it had become so bad she was having difficulty getting dressed. Her kids made the appointment to come in and see the doctor. On the day of her exam, she seemed slower and a bit depressed, had a low-grade fever, and though she did complain of pain as I tested her, the strength in her arms and shoulders seemed excellent for a woman her age. The rest of the exam was normal, and my suspicion of polymyalgia rheumatica, or PMR, was validated when a blood test called the erythrocyte sedimentation rate, or SED rate, was high. The SED rate measures how fast red blood cells settle in a test tube, measuring how much inflammation is going on. The good news is that PMR responds remarkably to low and easily tolerated doses of steroids. I put her on 5 milligrams of prednisone, and in a week, she was a new woman and back in her garden. She stayed on that dose for a couple of years with minimal side effects, and finally was tapered off 1 milligram at a time over a 5-month period. Polymyalgia rheumatica means many muscle pains due to an immune system problem. And we think it might be a viral triggered process that happens more frequently in certain families. Usually PMR occurs in those greater than 50 years of age with an average incidence of 70, and occurs more than twice as often in women than in men. It's important to know that 15% of the time PMR runs with another problem that can cause blindness. So severe muscle stiffness with vision changes should get immediate medical attention. That said, most stiffness with age is not PMR and gets better with movement and exercise. However, if there is a new life-limiting neck, shoulder, and pelvic stiffness, it could be polymyalgia rheumatica, and there might be some help to get you back in your garden.